Imagine a world where millions of people living with HIV wake up one day to find that their lifeline, the medication keeping them alive, has been cut off. Hospitals turn away patients because they've run out of antiretrovirals. Pregnant women, once assured that their babies would be born free of HIV, are now left with no options. Prevention programs that once kept new infections at bay vanish overnight. This isn't a scene from a dystopian novel. It's the chilling reality we could face if USAID funding for global health programs were to stop. For years, USAID has been the backbone of HIV and hepatitis B care in some of the world's most vulnerable regions. It funds life-saving antiretroviral therapy, ART, for millions of people, ensuring that they stay healthy and that the virus remains undetectable and therefore untransmittable. Cutting this funding would mean drug shortages, treatment interruptions, and a surge in drug-resistant HIV strains. The consequences? More infections, more deaths, and a crisis that could set us back decades in the fight against HIV. And it's not just HIV care that would suffer. USAID plays a crucial role in preventing mother-to-child transmission, rolling out pre-exposure prophylaxis PrEP for those at high risk, and supporting testing campaigns that help people know their status early. Without these, we'd see an explosion of new infections, particularly in sub-Saharan Africa and Southeast Asia, where USAID has been a game changer. Then there's hepatitis B, a silent killer that often goes unnoticed until it's too late. Millions rely on USAID-backed vaccination programs to protect newborns from lifelong infection. Stopping funding means fewer babies getting vaccinated, more cases of chronic hepatitis B, and an eventual rise in liver cancer deaths. And let's not forget treatment. Many hepatitis B patients depend on USAID support for affordable antiviral medications that keep the virus under control. Without it, liver complications will skyrocket, and health systems that are already stretched thin will crumble under the pressure. This isn't just a health crisis, it's an economic and geopolitical disaster waiting to happen. Low-income countries that depend on donor funding will struggle to make up for the shortfall. Out-of-pocket healthcare costs will rise, forcing families to choose between food and medicine. Other global health donors like the Global Fund and UNAIDS may try to step in, but their budgets are already stretched. And history has shown us what happens when funding dries up. Diseases we thought we had under control come roaring back. The fight against HIV and hepatitis B is at a critical turning point. We've made incredible progress, but we're nowhere near the finish line. Cutting off USAID support now would be like stopping a marathon runner 5 meters from the finish line and telling them to start all over again. We cannot let that happen. If you believe in a future where HIV and hepatitis B are no longer threats to global health, stay informed, stay engaged, and most importantly, help spread the word. Subscribe to our channel for the latest updates on medical research, clinical trials, and breakthroughs that bring hope to millions. Together, we can ensure that progress isn't just a thing of the past. It's the path to a healthier future.